Welcome to healthU. Do you love eating spicy food? Today we're going to reveal a surprising medical discovery. Moderate consumption of spicy food can actually reduce cardiovascular disease mortality by 26%. But excessive intake might trigger acute myocardial infarction? What's really going on here? Dear friends and health practitioners, regarding the relationship between eating spicy food and cardiovascular health, the medical community has made very important new discoveries. Based on 15 high-quality studies published in 2024 in the Journal of the American Heart Association and the British Journal of Nutrition, we finally have scientific answers to this question. First, let me introduce you to the magical component of chili peppers, capsaicin. Capsaicin is the main chemical compound that makes pepper spicy, and its mechanism of action in our body is quite remarkable. When capsaicin enters our body, it activates a receptor channel called TRPV1. This receptor acts like a switch in our body. Once activated, it triggers a cascade of physiological reactions that are beneficial to our cardiovascular system. What happens when this TRPV1 receptor is activated? First, it promotes vascular endothelial cells to release nitric oxide, causing blood vessels to dilate and improving blood circulation. Second, it activates a protein called SIRT6, which can prevent atherosclerosis and calcification. Third, it regulates inflammatory response, reducing inflammatory factors in blood vessels and protecting cardiovascular health. Sounds complicated, right? Simply put, capsaicin acts like a cleaner and protector for our blood vessels, helping our cardiovascular system maintain a healthy state. So, what do the actual research data show? A large-scale meta-analysis study in 2024, involving multiple countries with over 500,000 participants, found that people who regularly consume moderate TA amounts of chili peppers had a 12% reduction in all-cause mortality and an even more impressive 26% reduction in cardiovascular disease mortality. These numbers are truly remarkable. Regarding blood pressure, research has also revealed interesting phenomena. A prospective study of 9,273 people showed that moderate chili pepper intake can regulate blood pressure through neural reflex mechanisms. Capsaicin activates the vagus nerve, producing what's called the Bezold-Jarisch reflex. This reflex slightly slows down heart rate and causes blood vessel dilation, thereby lowering blood pressure. In terms of cholesterol, clinical trials found that patients with initially low HDL cholesterol levels showed an average increase of 0.08 millimoles per liter in HDL cholesterol after supplementing with appropriate amounts of capsaicin. Additionally, capsaicin can reduce intestinal absorption of lipids, helping improve blood lipid profiles. Regarding stroke risk, a study published in the British Journal of Nutrition that followed 50,000 people for 10 years found that people who regularly consumed chili peppers had significantly lower rates of ischemic stroke. Particularly interesting is that when chili pepper consumption was combined with the DASH diet pattern, the protective effect was even more pronounced. However, every coin has two sides. While moderate spicy food consumption has protective effects on the cardiovascular system, excessive intake can pose risks. Medical journals have reported such cases. A young, healthy adult who suddenly developed coronary artery spasm after consuming large amounts of capsaicin in a short period, resulting in acute myocardial infarction. This is because capsaicin has bidirectional effects. In moderate amounts, it's a protector of blood vessels. In excessive amounts, it may become an irritant. High doses of capsaicin can overstimulate the sympathetic nervous system, causing blood vessel constriction, increased heart rate, and even triggering arrhythmias. So what constitutes moderate consumption? According to research recommendations for generally healthy adults, consuming chili peppers 1 to 4 times per week is the ideal frequency, with each serving equivalent to about 1 to 2 grams of dried chili powder or equivalent fresh peppers. The key is to incorporate it into daily meals and avoid large single doses. Recommendations vary for different populations. Elderly friends having more sensitive digestive systems should start with even lower doses and monitor blood pressure changes. Patients with existing cardiovascular disease should be even more cautious and should consult with their physicians first. Special attention should be paid to certain groups who are not suitable for spicy food consumption. This includes patients in the acute phase of peptic ulcers, those with severe gastroesophageal reflux, patients recovering from acute cardiovascular events, and people allergic to chili peppers. Different varieties of chili peppers also have varying health effects. For example, cayenne pepper has moderate heat with a Scoville heat index of about 30,000 to 50,000, rich in potassium and B vitamins, making it suitable for daily health maintenance. Habanero pepper is very hot, reaching up to 500,000 on the Scoville heat index, with more pronounced cholesterol-lowering effects, but should be consumed in small amounts. Jalapeno pepper is milder at only 15,000 Scoville heat index, rich in potassium and suitable for beginners trying spicy foods. In clinical practice, physicians usually recommend a phased approach. First is the assessment phase. Thoroughly understanding cardiovascular history and current medications, evaluating digestive health, and measuring baseline blood pressure and heart rate. Then comes the initiation, N phase. Starting with low doses, eating spicy food only 1 to 2 times per week, carefully observing the body's reactions. Finally, the maintenance phase, adjusting dosage based on individual clinical responses and regularly monitoring cardiovascular indicators. I want to especially remind everyone that chili pepper consumption is absolutely not a panacea. It's just one component of a healthy lifestyle and must be combined with balanced nutrition, regular exercise, adequate sleep, and stress management to truly achieve cardiovascular protection. The medical community is currently conducting more in-depth research. Scientists hope to identify the optimal dosage ranges for different populations, understand how genetic polymorphisms affect capsaicin efficacy, and determine whether there are interactions between capsaicin and commonly used cardiovascular medications. To summarize, according to the latest scientific evidence, moderate consumption of spicy food does have protective effects on cardiovascular health, reducing cardiovascular disease mortality by 12 to 26%. The main mechanisms work through TRPV1 receptor activation, improving vascular endothelial function, reducing arterial calcification, and providing anti-inflammatory effects. But the key word is moderate. Excessive intake may lead to acute cardiovascular events, especially dangerous for people with underlying conditions. Therefore, I recommend that while everyone enjoys the delicious taste of chili peppers, they should adhere to the principle of moderation. If you have any cardiovascular disease or digestive issues, you must first consult with medical professionals. Health is not achieved overnight but requires persistent lifestyle adjustments. Moderate spicy food consumption is just one of many healthy habits, and only when combined with other healthy behaviors can it truly achieve the effect of preventing cardiovascular disease. Remember, any nutritional or health advice should be adjusted according to individual circumstances. If you have any questions, please be sure to consult qualified medical professionals. That's all for today's analysis. I hope it's been helpful to everyone. If you found it useful, remember to like and subscribe. See you next time.